Hey there everyone, Kate Perkins here from Cancer Rehabilitation and Lymphatic Solutions and the founder of the Bounce Back from Breast Cancer program. I wanted to bring you another video talking about tissue mobility, and last video I talked about tissue mobility post radiation therapy. Today I wanted to talk to you about tissue mobility following a mastectomy or breast surgery, and how to manage that scar, and also how to increase your tissue mobility. Often I see here in the clinic, if one of my patients had a mastectomy and the scar tissue and tissue around that scar is not mobile, then shoulder mobility is certainly restricted. And that mobility restriction can come from the scar, but also down along the pec major and right down into the rib cage. So it is recommended to massage your surgical scar. Certainly you can start really gentle massage about week 3 to 4 post-surgery. And that's not a vigorous, hard massage. It's really gentle. And what I encourage my patients is to, certainly if it's a mastectomy scar, to go above or below and just put a tiny little bit of pressure on the tissue and just slightly move backwards and forwards, not up and down. But, so this is week 3 to 4 post-surgery. So a tiny little bit of pressure, using the flats of your fingers, and you're just getting a little bit of mobility and desensitizing around the scar as well. So you might feel a bit numb. The scar might feel a bit weird to touch. So it's really important to bring some life back into that area and start mobilizing a little bit. And it's, as I said before, it's not a vigorous massage. You're not causing any type of friction. So as you get down the track post-surgery, you want to apply a little bit of pressure, and often you're going to find that the tissue is actually quite tight. And what you want to avoid as well is tissue adhering to the chest wall. If that adheres to the chest wall, then you're going to definitely experience some restricted range of movement. So if you, again, using the flats of your fingers, applying that pressure, and so I'm not causing any friction across the skin. So I'm actually mobilizing that tissue. And you can go across, backwards. So even just holding it like I did in my video explaining about softening radiation scar tissue. So it's a tissue glide technique. So apply that pressure, move the tissue to the point of resistance, hold it there for about 10 to 15 seconds, and then take your hands off. And then just grab the tissue, a little bit of pressure, and move it around. And so you can do that above and below a mastectomy scar, and you can go right along above and below the scar, just to get that mobile. So underneath the scar is the inframammary area, and you want to be able to keep that mobile as well. So using the flats, and it's almost like cupping your hand, and you can lift your hand behind your head. So that's also creating a stretch and increasing that shoulder mobility. And so you want to cup your hand like that, and just taking that tissue to the point of resistance, moving it, and then coming back, and then going backwards again. So it's about tissue mobility. And when the scar has healed and it's all closed, and that tissue granulation is complete, then you can start going over the scar. And again, pressure on the scar. It's not a friction over the surface, so you're actually getting that full tissue movement. If you've got any questions, please pop them into comments or send me a message. And if you want to hear more, please subscribe to my YouTube channel, Bounce Back from Breast Cancer, and look out for more videos.